Hello, my name is Cheryl Myers and I'm the Head of Scientific Affairs and Education for EuroMedica. Thank you so much for joining us today. I'm going to be talking about clinical OPC. Well, as you know, OPCs are the compounds that are found in grapeseed that give them their multitude of benefits. And the long version of OPC is Oligomeric Proanthocyanidin. Sure is a lot easier to say OPC. Now, when we look at trying to get these beneficial compounds into the body, there's a couple of challenges. For one thing, OPCs come in all different sizes. Sometimes I tell patients they can be Chihuahuas or they can be Great Danes. If they're Great Danes, there's no way they're going to squeeze through the doggy door. Ever so much better to have Chihuahuas that can scoot in as easy as can be. So that's the important difference. One of the important differences, at least about clinical OPC, is that every single OPC is standardized for a molecular weight that is small enough to be absorbed. There are other OPCs called tannins, which are not dangerous, but are not absorbable. You know, we find tannins in red wine, we find tannins in tea. You know, they give you that puckery sensation, that puckery mouthfeel. So tannins are not dangerous, but they do not absorb. They're too large to be absorbed. Unfortunately, even non-absorbable OPCs still count towards the total on the label. So even though the label may have a very high standardization of these incredibly important beneficial compounds, that doesn't mean that you're getting the full benefit. That's why I believe it is such a tremendous step forward scientifically in order to have the ability to make sure that every single OPC in this product is of a molecular weight that is easily absorbable. So 100% absorbability can make a tremendous difference in the impact that you see using this product in your patients. It can be used for supporting heart health, brain health, vascular health. It can be used to help support other immune functions in the body as well. So many ways that you can use this product. So it's clinical OPC. It's designated VX1. It has been used in several published scientific studies. It is from France. It is a very high quality grapeseed, 100% guarantee, not adulterated. That's the second issue we see with people that are selling grapeseed extracts. They become more expensive and adulteration begins. And one of the compounds that they use to adulterate OPCs to drive up the total are red peanut skins. Red peanut skins do also contain tannins, and they can bump up the label total. Unless you are analyzing specifically to make sure there are no peanut ingredients in your product, you will not detect them on the standard assays. That's why we do the extra step of making sure that we validate that it is indeed a 100% grapeseed product and there is zero adulteration. So for those two reasons, the standardization to make sure it's 100% absorbable and the extra level of testing to absolutely assure that no adulteration has occurred combine to make this a tremendously powerful product. I hope you'll contact us if you have more questions on this or any EuroMedica product. Thank you so much for your kind attention.